What do you think of when you hear the term metabolic health? Now, what do you think of when you hear the term obesity or overweight? Do the two naturally go together in your mind? I think this is such a fascinating topic and something that's really been of note lately during this COVID pandemic, because the data that has come out about COVID was first that obese people were at risk, then people with diabetes were at risk. And the question is, well, is it the metabolic dysregulation that comes with being obese, or is it the obesity itself? And it's not just for COVID, it's for anything, whether it's risk of premature death, risk of cancer, risk of cardiovascular disease. Is it the excess weight, or is it the metabolic changes that come along for many people who have excess weight? And it has profound implications, because if it is the metabolic changes that come with excess weight, then weight loss isn't the goal, but fixing the metabolic dysfunction is the goal, and frequently weight loss follows. Whereas if it's the weight loss itself, then any form of weight loss should be beneficial. Now, I clearly have my bias, but now we have a study to kind of help us understand a little bit more about this. I'm Dr. Brett Scher, the medical director at DietDoctor.com, and I want to talk about this study recently published in JAMA Network Open. It's got a big, long title, an empirically derived definition of metabolically healthy obesity based on risk of cardiovascular and total mortality. Long name, but the point being is, what they did was they went back and they looked at two huge databases, one from NHANES and one from Biobank in the UK, and they looked at obese individuals and those who had risk of dying prematurely, and what health parameters they had beyond their weight, focusing on blood sugar and blood pressure and waist to hip ratio and other factors, crunching the data and seeing which ones made the biggest difference in terms of risk of premature mortality. And what they found was the top three. One, blood pressure, systolic blood pressure below 130, not on blood pressure medicines, was sort of protective, and above that put them at risk. A waist to hip ratio below 0.95 for women and 1.03 for men, and no diagnosis of diabetes. Now, first, I have a little bit of an issue with the diagnosis of type 2 diabetes, because it treats it like a binary condition. Either you have it or you don't. If you're just short of the cutoff for the diagnosis, you're fine. And if you're just over the cutoff, you're not. I have a little problem with that. I think we need a little more granularity about that, about insulin resistance, about the progression of type 2 diabetes and the risk, how long you've had it, how severe it is, those types of things. So I have a little problem with that. But you got to draw a cutoff somewhere for these types of studies. But what I think the take-home message for this study is that maybe not all obesity and not all overweight is the same. It's more the metabolic conditions underlying that. So any intervention to reduce weight loss, if you're concerned about improving your health, has to address the metabolic abnormalities. And specifically, you can measure that by looking at your waist to hip ratio. Waist to height ratio has also been a validated marker in the past. Also, blood pressure, so important. And of course, blood sugar and insulin resistance, so important. So whether their exact definitions are the best for everybody, whether it was the best quality study, there's still some questions about that. But the underlying concept is what I want you to walk away with. Weight is important. It can change how you feel about yourself. It can change your ability for physical activity. It can affect your knees and arthritis in your back. It can affect many different things in your life. But one of the things that also it affects is that metabolic dysfunction. And that is the key for comorbidities, for dying prematurely, for potentially for cancer and heart disease, neurodegenerative disease. It can be linked to so many different things, but it's that underlying metabolic dysfunction that needs to be targeted. So when you're looking for a way to lose weight, look for a way to lose weight in a healthy way. And that's something we repeat over and over again here at Diet Doctor. Healthy weight loss, maintaining lean muscle mass, losing mostly fat mass, doing it in a way that you can sustain long term, in a way that you enjoy, in a way that improves your metabolic health and reduces your hunger. Those are the keys to healthy weight loss. And here's one more study just to show how important that is. All right, I hope this was helpful. You can check out the link to the study. If this was helpful, please click the thumbs up and the subscribe down below so you'll get all our updates here on Diet Doctor News on YouTube. Thanks a lot, everybody. Have a great day.